So we're here to do a belly button revision or an umbilicalplasty. Basically, this is our patient. She's actually not had any procedures before, but you could see how her belly button is a little more protuberant than a typical belly button. So we're gonna go in there, mark this out, and reduce the size and make it more of an innie. Come on, let's get going. Our patient is 27 years old. She's had 2 children, and she's always had any kind of outie belly button, and then she tried to get this previously fixed. However, now she has more of a protuberant type of belly button. Okay, so we're going to do an umbilicalplasty for her, reduce this size, and try to take in a little bit of this excess skin to get it to look more like a normal belly button. We expect at least a 50% improvement today. These things are always unpredictable, but I definitely think we can make some progress and some improvement here. So come on, let's get started. We're gonna get started. First thing we're gonna do is gonna debulk this belly button. Patient's wide awake. She's watching some YouTube or some Netflix right now. So we're gonna debulk this and then bring it all back together. So we're suturing down the remaining pieces here. The goal is we want this to kind of be tuckered down and then everything else to kind of come down to it. Okay, so you can see where we're at right now. It's looking more like a normal belly button. We've got first 2 layers of sutures in. We're going to put in the 3rd layer now to really hone it in. So you can see the tissue that we took off here. That's the excess belly button, extra skin. There's kind of a little favor for her at the top portion. And then all this little scar tissue that was inside, for whatever they did previously, we removed that so we could tuck it back down under. If you come take a look over here, here's our final result. Much better. We're gonna put some antibiotic ointment on it now and she'll be good to go.